Pediatric ophthalmology itself is very new in the field of ophthalmology, and it's still developing its roots. It takes time to find the right balance. The balance of experience, the skill, and the skill transfer.
Certainly, it seems like attitudes are changing towards pediatric ophthalmology.
Yeah.
And as you mentioned, it's quite a new kind of subspecialty. How have you seen it change in recent years? And how do you hope it's going to progress in the next few years with efforts from yourself as well as others?
Pediatric ophthalmologists are very friendly people any which way. We've always been a very friendly, very close knit group. And now I see the wings expand. I see more ophthalmologists coming in. We started talking about pediatric retina coming in, pediatric cornea coming in. What I want to see more is I want to see pediatric ophthalmology taken more seriously. We have a lot of general ophthalmologists who do pediatric care. But the thing about pediatric ophthalmology as per se is that it's like hanging art. You're painting something and you're going to hang it for the next 80 years. So you better be good at it. You operate on a child or you give treatment for a child, you want to make sure you're giving the best, because that child is going to keep coming to you. He's going to keep coming, he's going to keep seeing. So it's like seeing that art every day in your drawing room. You want to make sure it's A1. So that's where speciality comes into play.
What are some of the conditions, diseases, or things to look for when you're first working with an infant?
When you're working with an infant, I think the first most thing that you really need to be at is you have to treat them with care, with patience, and with a smile. And I think expecting them to get into your OPD and get out in 5 minutes is not the practical way of doing things, because a lot of what you see an infant present with happens outside your OPD. It doesn't happen inside the chamber. So if you're going to be observant and you're going to walk around and see the child while the child is waiting for you, you'll pick up more signs and symptoms that you will later reflect on and give a more proper diagnosis. At the same time, when the child walks in, having expectation that he's going to just walk out and I see 10 children in an hour is not going to be. They need their own time. They sometimes need multiple visits to figure out what's happening. You also need to be great at your retinoscopy. So you see a lot of optometry being spoken about in pediatric ophthalmology, because those telltale signs take you a long way with your diagnosis and your treatment. And most and foremost, you have to be updated yourself. You can't be somebody who just does pediatric ophthalmology, goes home and then forgets about it. You have to keep coming to these meetings because they're new things. Children deserve the best and we need to update our skills all the time. So that's where all the difference is. The diseases we talk about nowadays the most is myopia. You've seen how COVID has impacted myopia, how screen time has impacted myopia. So what we are looking at now is to create an early impact so that a child does not become highly myopic and the progression stops. So there are new treatments which are coming on, new glasses coming on, orthokeratology which is doing very well. We have atropine for myopia. We have other medicines also in pipeline who are going to come and make a difference as far as myopia is concerned. And most and foremost, I feel personally, is the awareness about myopia. A lot of awareness in Asian population, even the European population is, oh, my child has glasses, full stop. But that it shouldn't stop at full stop, because we have treatment. We have things we can do to prevent it.
What do you find are some of the barriers with getting that information out to the general population and to parents in particular?
So the first and foremost, I think, is adapting to and accepting that there's new technology available, there's new medicines available, and if they're delivered early, we can actually make an impact. The age-old art of spending time with the child and the parents, sometimes the grandparents, is very important, because you need to address the reason why we are in the room.
Yeah.
What we need to do in the lifestyle change, because there is a difference. When we were children or when our grandparents were children, the incidence of myopia or glasses or refractive error was much lesser. So the lifestyle that we've caged ourselves in the urban population, being indoors, reading more, more of screen time, that all has impacted.
Yeah.
And that impact has to be undone, or balanced rather, in a certain way, because a lot of parents tell me, it's impossible to be off screen time.
You're here, as you mentioned, with the young ophthalmologists, and for the first ever time, the young pediatric ophthalmologists. Can you tell us a little bit about what's so important about these young ophthalmologists societies, and particularly this first one that you've hosted here in Malaysia?
So young ophthalmologists are a vibrant bunch. We know that. And they all need to be together to make a change which is more impactful. And getting a young ophthalmologist or encouraging a young ophthalmology society does exactly that. It brings a group of very enthusiastic, future thinkers, creative minds together in the same room, and gives them the confidence that they can speak their mind. And that speaking of their mind encourages not only this generation, it'll encourage the next few generations as well. We want that encouragement and to be with everybody, and we want to also network all over the globe so that the right education reaches the right person. We aspire to do is we aspire to give quality eye care to everybody with the same way. That's why we are in these conferences trying to add to our skills so that when we go back home, this skill transfer goes to everybody. So I think that similar like-mindedness comes from when your group thinks in a similar term, and that encourages a lot of us.
Well, it's been a pleasure to speak to you today. Thank you so much. Yeah. And we'll be definitely following your activities, and I'm hoping we get to see you again in the near future.
Likewise. I'm always encouraged when I see Matt, you, and the team Media Mice do such great work.
Well, it's a pleasure.
Thanks so much.
Well, thank you guys for watching, and that's us from KL, and we'll see you again.